In this video, we are presenting a patient undergoing robot-assisted radical prostatectomy while his lung function was monitored by electrical-impedance-tomography, EIT. The recordings were performed at the University Hospital, Hamburg-Eppendorf, Germany. We thank the entire team of Professor Reuter for their willingness to explore with us the potential of electrical impedance tomography in this field of application. We investigated a 62-year-old male scheduled for routine robot-assisted prostatectomy. Before starting the actual EIT measurement, gender, height and weight had to be entered in order to obtain the patient's specific EIT contours. In this first sequence, we are showing images of spontaneous breathing in sitting position. Ventilation is equally distributed between the right and left lung. Only 2% silent spaces appear in the ventral lung. Now we are showing the patient breathing spontaneously in supine position. Ventilation is equally distributed between the right and left lung. A negligible amount of 3% silent spaces are located in the non-dependent lung region. After induction of anesthesia, the patient is mechanically ventilated using a volume-controlled mode at a PEEP of 5 cm of water. During mechanical ventilation, a shift of ventilation towards the ventral non-dependent lung can be noticed, and the amount of dependent non- or poorly ventilated silent spaces increased to 12%. Before recording the following sequence, the patient was placed in a Trendelenburg position with a head down tilt of approximately 30 degrees and the PEEP was increased to 10 centimeters of water. Despite the elevated PEEP, ventilation shifted even more towards the ventral lung area. And the respective amount of silent spaces in the dependent dorsal lung increases to 21%. After release of the capnoperitoneum, the patient returned to the supine position and was once again ventilated with a PEEP of 5 centimeters of water. Note that ventilation returned to the dorsal lung areas, with dependent silent spaces returning to lower values than after induction. The following sequence shows the trend of the silent spaces during the different phases of the perioperative period. During spontaneous breathing, almost no silent spaces were measured. Once the patient was mechanically ventilated, the amount of silent spaces in the dorsal dependent lung increased to 12% and increased even further during the Trendelenburg position. Once the patient was back in the supine position, they returned to post-induction levels. These same EIT sequences were recorded in 40 patients. The silent spaces increased when switching from spontaneous breathing to controlled mechanical ventilation. The highest amount of silent spaces was found in the Trendelenburg position. Not only the silent spaces increased during the operation, but also the center of ventilation shifted towards the ventral lung area. These novel insights into the perioperative regional lung function were published in the British Journal of Anesthesia. Please download the publication for detailed information. Thank you.
Do things right. EIT, real-time monitoring by Swisstom.